Welcome back, guys. We have some special guests in the studio today, McKenzie Benton and Christa Rudat with me to talk about the North Baldwin Infirmary Birth Center. Thank you, ladies, for stopping by.
Thank you for having us.
So we were chatting earlier about how North Baldwin Infirmary is a baby-friendly designed facility.
Yes,
what does that mean to be baby-friendly designated?
So Baby Friendly is, just a little history on it, is a worldwide program. It was founded in 1991 with the World Health Organization and UNICEF. The first U.S. hospital to get its accreditation was in 1996. It has definitely since then grown. Of the roughly 2,700 hospitals in the U.S. that offer maternity care, there are 605 that are designated baby friendly. So in Alabama State, there are 6 that have the designation, including North Baldwin Infirmary. Okay, we are actually the only baby-friendly designated facility in all of Mobile and Baldwin County. So we are definitely proud of that, and we work really hard to maintain that. The main goal of Baby Friendly is to uphold the higher standard of infant feeding care, and we do that by implementing the 10 steps to successful breastfeeding.
And I would imagine, you know, going back to what makes a baby-friendly designation, are there check marks that you have to meet for that?
There are. There are definitely lots of standards that we have to meet, and we do that by upholding the 10 steps to successful breastfeeding. And every 5 years we have an on-site designation where they send out assessors to our hospital, and they interview the staff, they interview the patients, they interview the physicians, and they all answer questions, and based on our assessment we get designated. So we were first designated in 2017, and we recently just got redesignated in 2022.
Nice. So we have a few new moms here, and I've got a girlfriend who has a baby at home as well. I want to talk about breastfeeding because for some it's easy, for others not so much. You mentioned some steps that make it successful. What are those?
So some of the big steps that we implement at the hospital are skin-to-skin care directly after delivery, where a newborn is placed right on mother's chest, and we do that right after any delivery, vaginal delivery or a C-section. And that helps set up good milk supply, bonding, good breastfeeding. Some of the other things we do are rooming in, so our babies stay in the room with their mom the entire hospital stay, which can sound kind of scary, but it's good because the nursing staff is there to help you and assist you, and the moms really get to learn about their baby and their feeding cues. And then we also offer a lot of support post-discharge, where we have baby bistro breastfeeding support groups. We do outpatient consults with patients in the community, so we really want people to be successful.
It can be difficult when you're choosing a facility to have your child, sometimes as determined by where your doctor is, but talk about the benefits of having a baby at your facility.
The benefits kind of go hand in hand with the 10 steps that, you know, the patients see, which is the rooming in especially. You're not having a baby taken to the nursery to be seen by the physicians. You know, that, especially for new moms, can cause a lot of stress. And it's not just stress for mom, but it's also stress for the baby.
Exactly.
So it's actually, in the evidence-based studies that they've done, they've seen that it decreases those stress levels for mom and baby just by keeping them together. And that's not always the case in the surrounding facilities.
All right. Well, as a mother of 2, I definitely know the importance of that skin-to-skin contact. I appreciate you ladies coming in and lending your voice to this topic and sharing information about what's available in our backyard. We're going to have this interview available on our YouTube channel, our website too, so you can share it with someone you know. Thank you, ladies, for stopping by.
Thank you for having us.